At Neuroscience 2018, researchers presented new systems where computer-driven prosthetics can communicate with their wearers. These technologies are drastically improving our treatment of people with paralysis, prosthetic limbs, and blindness. At Battelle Memorial Institute, researchers developed Neurolife, a technology that can restore limb function in patients with paralysis.
Part of this project, we are working with a paralyzed individual who has a spinal cord injury and has no control over his hand. So we record signals from his brain when he's thinking about moving his hand. We use computer algorithms to decode his intent, whether he's thinking about opening his hand or closing his hand or flexing his finger.
The decoded signals are sent to a muscle stimulation system wrapped around the patient's arm, which stimulates the muscles necessary for the movement the patient is thinking about. This essentially bypasses the nervous system, linking the paralyzed limb directly to the brain.
Again, it comes back to making this technology something that will be useful in their daily lives. You don't want to send a participant with this technology, a complex technology, and just have him do one or two tasks. They would like it to be part of their activities of daily living.
At Florida International University, researchers designed a bidirectional prosthetic hand, meaning patients can sense pressure in the hand similar to a limited sense of touch.
The neural-enabled prosthetic hand system is designed as a bidirectional system so that when a person who has a limb loss uses a prosthetic hand, then when they use the prosthetic hand, sensors within the prosthetic hand provide signals of grasp force or hand opening. That information is decoded, and that decoded information is then transmitted through a wireless link to an implanted neurostimulator.
This breakthrough could allow people with prosthetic hands to complete tasks in a more natural, intuitive way.
So it's fit to you, it's a personalized system. And it says that, okay, this is what is going to represents pressure, this represents hand opening. So now when they're going to do a task, they are going to be like you and I. We don't think about it that we are opening our hand or closing it. They are able to then feel what they are doing, naturally speaking.
At Brown University, researchers are developing an algorithm that converts recorded visual information to sound cues, essentially mimicking the visual cortex for patients with blindness.
We're using a few different approaches. One is explicit verbal cues, or you can try something with additional layers to it. So you can imagine there's a way to play a sound through a pair of headphones, or in our case, bone conduction headphones that don't block the person's ears, that makes it sound as if it's coming from a particular location.
Researchers hope that future studies can further refine this technology to allow for everyday use.
There's a need for research on cues that are natural and intuitive. There's a need for research on interpreting the context in which the person is trying to complete some tasks.